Good morning. I'd like to call this meeting to order. And before we begin, I would ask that the cell phones be placed on silent or vibrate. And we'll start off with the introduction of members, starting with Ms. Lonescroft.
MLA Suzanne Lonescroft, Lunenburg constituency.
Margaret Miller, Hands East.
Joachim Stroink, Halifax, Chebucto.
Good morning. My name is Tim Houston. I'm the MLA for Pictou East.
My name is Frank Corbett. I'm the MLA for Cape Breton Centre.
Morning. Dave Wilson, MLA for Sackville-Cobequid.
Down to Mr. McGuire, who came in late, or not late.
Brendan McGuire, Halifax Atlantic. Wasn't late.
It's still 9 o'clock. And I'm the Vice Chair of the committee, filling in for Mr. McMaster, and I'll be chairing the meeting today. And the introduction of witnesses.
I'm Shelley Rowan. I'm the Vice President of Prevention and Service Delivery with the Workers' Compensation Board.
Stuart McLean, the CEO, Workers' Compensation Board of Nova Scotia.
Leo McKenna, Chief Financial Officer of the Workers' Compensation Board of Nova Scotia.
And just for the committee business, as of June 19th, Ms. Margaret Miller, MLA, who has introduced herself, is a permanent member of the committee. So just to note that. Today on the agenda we have the following item: the Workers' Compensation Board, and the subject would be the Safety Association funding. So we'll start off with the opening statements from the witnesses.
Thank you, Mr. Chairman, members of the Public Accounts Committee. Very pleased to be here today on behalf of the Workers' Compensation Board of Nova Scotia. Just my colleagues, as we've met both Leo and Shelley Rowan, two of our vice presidents, our chief financial officer, and our VP of Prevention and Service Delivery. In addition, our client relations officer, Tim McGuinness, who may be a familiar face to many of you, is in the gallery today. Also in the gallery are some of the province's most passionate safety champions, Nathan Blades, who's the chair of the Fisheries Safety Association of Nova Scotia, Trevor Bent, the chair, and Jordan McDonald, treasurer, both with the Nova Scotia Trucking Safety Association, Susan Dempsey, who's the executive director of Aware Nova Scotia, who serve Nova Scotia's health and community services industry, and then Bruce Collins, who's the general manager of the Nova Scotia Construction Safety Association. Mr. Chairman, members of the committee, we're making progress, and I'd like to start with that. Together with our partners, we're preventing injury. We're helping people get on with their lives when an injury does occur. Evidence of this: since 2005, workplace injuries have declined by more than 30%, from over 9,000 time loss injuries to today less than 6,000. The number of days lost to workplace injury has also declined. It was 1.2 million in 2005 to today we're just about over 600,000 days. And the number of people who go on to receive extended benefits, which is perhaps one of the most important things that we measure, is down by some 40%. We're also pleased to have a very committed board of directors whose members represent the viewpoints of both workers and employers. We also are fortunate to enjoy a very strong working relationship with the safety branch of the Nova Scotia Department of Labour and Advanced Education. Together with our partners in government and safety associations, we've developed and we're implementing Nova Scotia's workplace safety strategy. And that's towards the vision to make the province the safest place to work in Canada. Change is needed to achieve that, and that change must come within industry and the behavior of industry and the behavior of individuals, so that people will get to a place where they'll only do something if they can do it safely, and safety is seen as a priority. Nova Scotia has 8 industry safety associations that are improving safety performance. These safety association leaders that are here today also have contemporaries in forestry, retail gasoline, automobile dealers, and farming sectors, and they're all doing incredibly important work and have proven their ability to positively impact safety outcomes in the sector. As an example, in the construction sector, by building relationships, focusing on education, helping with training, developing effective safety systems and audit programs, the Construction Safety Association has helped more workers come home safely, to the tune of they've cut their costs by more than 2/3, and since their inception have reduced their rates by greater than 30%, to some of the lowest rates in construction in Canada. Other industries supported by safety associations are seeing similar trends. It's not all about the rates, though. If we look at some of the initiatives, Aware Nova Scotia has new programming on workplace violence in the healthcare sector. The Fisheries Safety Association is promoting PFD use and also man overboard demonstrations and has a conversation to improve things there. The Trucking Safety Association is doing that by encouraging homes and businesses to make their properties safe when their workers arrive and they're working in their workplaces. Safety associations, as we're here to talk about funding, are funded in a number of various ways. The funding for most of them comes from levies, where WCB collects premiums and we collect a little bit extra so they don't have to have an accounts receivable department and those extra administrative costs. They're directed by orders in council or by a contractual arrangement on assessment premiums. There are two exceptions to this. One is Aware Nova Scotia, who are funded directly by the Nova Scotia Department of Health and Wellness. Whoops, excuse me. My legs are too long. And the Farm Safety Association, that's funded by the Canadian Agricultural Safety Association and Nova Scotia Federation of Agriculture. Mr. Chairman, members of the committee, we're proud of what Nova Scotia workers and employers have accomplished. Continuous progress in workplace safety will take the commitment of all of us, including government, industry, labor, safety associations, and all Nova Scotians. That's what's unique about the new workplace safety strategy, is there's a place for all of us to understand that there's a role for everyone. Together, we can continue to reduce the human and economic toll of workplace injury. My colleagues and I are here, and I'm pleased to respond to any questions. Thank you, Mr. Chairman.
Thank you. So we'll start with the PC Caucus for 20 minutes. Mr. Houston.
Thank you, Mr. Chair, and I'd also like to make a quick introduction before we start. I see Mary Lloyd and Larry Maloney from the Pictou County Injured Workers Association in the gallery, so I thank them for coming this morning. I thank the witnesses for appearing. We have quite an unfunded liability for the Workers' Compensation Board. What's the current unfunded liability as we sit here today?
Currently, we're at 71% funded. In round numbers, approximately $1.9 billion in liability and close to $1.5 billion in terms of the money that's in the accident fund. So we only have 71% of the money necessary to make the promises that we've made to injured workers to date.
Now that's an unfunded liability that's existed for some time.
Yes.
And I think the last time the Workers' Compensation Board appeared before public accounts back in 2010, they had a goal of addressing the unfunded liability by 2016. I think that was revised to 2021. So what's the current target for addressing the unfunded liability?
Thank you for the question. There are a number of things that impact the unfunded liability. Obviously, the number of people getting injured, the progress, investment returns. So all these different elements that would impact our funding position. As we all know, in 2009 there was a big downturn which had an impact on, in the investment markets, which had an impact on the fund, like it did in most pension funds. So today we're in a position where we're looking at a range of between 2019 and 2023, as we expect this to be. We're making progress each year. For example, we were 67% funded last year. This year, at the end of 2013, 71%. And again, it's going to take all of us to actually achieve that, and we're also, we need the investment markets to stay strong.
So is the 71% funded? That's at December 2013, or
That's correct.
Is there any more recent number now? It's like up till June maybe or something, or like
We haven't.
Mr. Rowan. No, Mr. McKenna, sorry.
Thank you. We haven't published the second quarter yet. We did publish the first quarter, and there was an improvement. We anticipate when we publish the second quarter that you'll see a further improvement.
Okay. So in terms of the way that the system works, I guess you did mention investment returns. I think I read that there's a targeted investment return of 10%. Did I read that right? That would be what the fund is expecting to return and are hoping to get on their investments over the next few years.
Mr. McKenna.
Thank you. We actually target between 7 and 8% over the very long term.
Okay, I'm not sure. I think it's probably pretty relevant, so I'll just I was looking at the annual report from 2013 on page 12, and it talks about a 5-year target return of 10.1%. 5-year rate of return 9.8, and then it says 5-year target. So I just want to make sure I'm reading those numbers correctly.
Mr. McKenna?
Sure, I can clarify that for you. So what we publish on that chart, we're comparing our actual return to the target return for that particular 5-year period. And so we calculate the target return for that particular 5-year period by looking at what happened in the various markets that we're invested in. So the comparison
So it's
there.
retrospective.
Exactly.
Okay, fine, fair enough. Now, and just in terms of targets, a targeted average assessment rate of 2.65. I think I must have got that off the same sheet. Is that, I'm just wondering about that targeted assessment rate and like how that might compare to other jurisdictions across the country.
Mr. McLean?
We have some of the highest assessment rates in Canada. The average assessment rate, you have to be careful with averages because, as an example, we don't cover banks, financed institutions, and insurance companies, which makes it difficult to compare to other jurisdictions where they typically have universal coverage and those industries are included in terms of workers' compensation. However, we do have high rates, and part of that is the fact that we're amortizing the unfunded liability. So if you back off the industry comparisons, we back off the unfunded liability, we're comparable to a lot of other jurisdictions. However, employers in Nova Scotia currently pay we have the highest average assessment rate in Canada.
Okay, and then
Sorry about that.
just to kind of, yeah, I do it too. Just to kind of orientate myself a little bit on some of these targets and stuff, I did see a targeted satisfaction rate of 70%.
Right.
So I'm just wondering what that means, especially in the context of, you know, I've talked to a lot of employees and injured workers that maybe aren't particularly happy, and I've also talked to a lot of employers that aren't happy with the rates. So I kind of see both sides of it in my everyday work, and I'm just wondering how you reconcile that with your targeted satisfaction rate and what that means.
Well, certainly we see the priority of providing service to all of the different constituents, and we also measure the satisfaction of our own employees as well, because we believe, you know, we need to understand what those things look like. We run surveys, and those surveys have a number of questions, and basically it helps us understand those priorities. The feedback from those surveys goes into our plans to try to have continuous improvement in terms of providing services to both the worker and the employer community. The 70% number is seen to be best practice from a third party. When we set up the metric on the balanced scorecard, our board heard representation from, you know, what would be a good measure to start with. We recognize that we're never going to, in workers' compensation, we're never going to make everyone happy by the nature of the fact that we're charging premiums to people who perhaps want to pay those premiums or perhaps see those premiums as high. And on the other side of the coin, an injured worker would say perhaps their benefits are not sufficient or benefits are low, and we know that those are issues in the system. However, we try to treat every injured worker, every employer, every interaction in a caring and compassionate way, try to educate and try to provide excellent service to the people who are stakeholders in our system. And our board keeps a metric. You'll notice that in 2013, for example, the indices both for worker, employer, and for our staff metric are above the 70%. They don't change that number, the 70, but the board does currently monitor us on a regular basis in terms of those surveys as they come back to ensure that we don't see any fundamental problems or changes that are taking place there.
Okay, so to move on a little bit and talk about some of the numbers. Looking at the administration, this may get Leo's attention up. Looking at the administration costs for the board, and I see 47 million in administration costs for 2013. I'm just wondering how that compares to other jurisdictions. It's probably not an easy comparison, but it must be something that the board looks at.
Mr. McKenna? Go ahead.
Thank you. It is something that we keep a very close watch on, and I can assure you that our board of directors keeps a very close watch on our administrative costs. Our board is a bipartite board with members from Labour and from the employer community, and I assure you that neither of those parties is interested in any more administrative spending than necessary. With respect to your question, how do we compare across the country? What we do is each organization submits to the AWCBC, the federal organization, a comparison where we look at the portion of our rate that goes to cover administrative costs. That same chart that you alluded to earlier, we show that, what's happening in Nova Scotia, and you can see that in 2013, 37 cents of the rate went to cover administrative costs. That positions us roughly middle of the country, probably a little bit higher than average, and I would submit to you that that's because as a relatively small jurisdiction, there are some costs that you're going to incur regardless of the size of your jurisdiction, and in a smaller jurisdiction you can't amortize them across quite as big a payroll base.
Okay. Included in the 47 million was 1.5 million in communication expenses. I'm just curious about that one. Like, what is that?
We would be happy to provide a detailed listing if you're interested, but the big components, we do a fair amount of advertising. I'm sure you've seen the kind of work that we're doing publicly to try and generate awareness of occupational health and safety, so that's a big part of that number. Also included, of course, would be our telecommunications costs, our printing costs, things like that.
So did I understand correct that the Department of Labor is actually the ones who do like the safety training and that type of working with workplaces as opposed to you guys? Because I'm just wondering about the need for advertising, I guess, in your business and the effectiveness of what you're advertising, what the message may be, if there's another department who's actually paying for the training and doing their own kind of awareness activities. Is there?
Mr. McLean.
Thank you for the question. When we look at advertising on its fundamental basis is very important to the things that we're trying to do, because we're trying to achieve culture change. We're trying to change the way people think when they're actually about to do something, that if it's going to put them in danger or there's something, they need to make a different decision. We also need employers to understand the role that they play, and also really move from knowing about health and safety to caring about health and safety. So that's why it's so important. To address your question directly, the Department of Labor looks after the enforcement and regulation that's associated with health and safety in the workplace. That we work hand in hand with them. I like to use the phrase virtual integration. In other words, the Department of Labor is perhaps our most important partner, because we really need to work hand in hand in terms of providing assistance. We have the mandate for prevention, but an OSH officer, every time they touch base with an employer when they're in their workplaces, has an opportunity to educate, an opportunity to help and ensure that we create the conditions for success. When you look at the costs of these types of things, you don't have to look any further than the fact that we pay about $200 million out in benefits to injured workers every year, and that the premiums are close to $280 million on the other side of the ledger, and that's a big cost to business as well. So what we're trying to do is we're trying to facilitate culture change, and I think some of that progress is evidenced in the results that we're seeing, that employers are now starting to embrace health and safety in new ways, and we're seeing workers making different choices and staying safe in the workplace, returning home to their families at the end of the day. But it is a continuum in terms of how we work together.
Right. So I'm still just a little interested in the need for advertising and the effectiveness of it. So if a worker is injured at work and then deemed fit to return to work, whose responsibility is it to make sure that the workplace environment has been modified to prevent that injury from happening again? Is that something that falls under your mandate, or is your mandate limited to just dealing with the injured person and not necessarily the environment? Because it was my understanding that it's more the Department of Labor that would deal with the workplace environment, and you're just trying to deal with the injured people.
So from a compliance perspective, absolutely, it's the Department of Labor that will be working in an employer's site who comes to make sure they have a JOSH committee, to make sure they have hazard identifications, accident, the different types of things that they need to create that safe work environment that are covered under the law. And from our perspective, what we have is, with the prevention mandate, we have people who would act as coaches and help people understand what best practice looks like. I think it's very important to highlight that the employer has not just a role but a responsibility to create a safe workplace for their workers. And that is all outlined in the Occupational Health and Safety Act, which goes hand in hand with the Workers' Compensation Act. Again, one more focused on the prevention, helping, et cetera. But our mandate is broader now. It's been about 10 years or so that we got the prevention mandate from the Department of Labor, was transferred to Workers' Compensation. And that mandate includes, in our strategic plan, things like social marketing and incentives, leadership initiatives, online tools. So it's the full gamut of trying to help ensure to create the conditions for success.
No, I appreciate that. But if the caseworker, I guess, deems somebody fit to return to work, they're kind of looking at that in isolation,
Right.
as in regards to the physical fitness of that person. Do they then say, well, you are physically fit to return to work, and guess what? We look back at we dealt with the employer, and the same thing's not going to happen. Is there any of that kind of connecting the dots, or?
Well, there is, and I'll just give you an example in the continuum of care. If someone gets injured, we try to do a functional assessment for that employee to make sure that we're not going to put them back in a circumstance that's going to get them re-injured. What can they do? A lot of the focus in the past was what can't an injured worker do, and then they'd go off and, they'd say, well, they can't work, as an example. Today, the focus is changing to stay at work, which we believe is best practice, the proximity with the workforce, et cetera. So we work with the workforce and the workplace. The caseworkers, in fact, are spending a lot more time with employers. They're out in the workplace, and they're trying to, if they have to modify workstations or whatever they need to do to make sure that that worker has a safe place to go back to, because we don't want the same thing to happen over and over again, clearly. And oftentimes, if things are systemic, we're sharing information with the Department of Labor, and they'll, if we see things that are happening, they will in turn respond either at the employer level or the industry level to make sure that we're working hand in hand to try to, get these hazards out of the workplace that are causing the majority of the problems.
I do have a bunch of questions about how you determine if a person is able to return to work and stuff, but I'm just so concerned about this unfunded liability, because I'm sure it impacts so much on how claims are assessed and everything else. And I did have a chance to read the Act, and in the Act, there's Section 116, I'm sure you guys are probably familiar with, but it states that where in any year there is an annual operating deficit in respect of that year, it is the duty of the board to ensure that by the end of the third year following the year in which the deficit occurred, the deficit is eliminated. So does that portion apply to the overall unfunded liability, or how is the unfunded? It grew for so many years even after this act was enacted.
Fundamentally, if you look where the unfunded liability actually came to be, it was actually the period back in the 70s and early 80s, so 1971 to 1986 to be exact, where costs were going up at a greater rate than premiums during that period in time. When the Act was modified back in 1992, there was this provision, 116, was put in the Act, and we've been fully compliant with that. We have comprehensive revenue each year. So in other words, we're mandated to collect enough premium to cover current and future costs with all the claims that take place in a given year, in the current year. When we have money that's in addition to that, and we're assured that because the actual assessment rates have an amount built in for the amortization of the unfunded liability, that extra amount, or what's left over after we pay the claims, after we pay Workers' Compensation's administration, the money that goes to the Department of Labor, the Advisors Program, WCAT, our other responsibilities, once those are all paid, there is an amount of money left over that goes towards the amortization of the unfunded liability. Our premiums need to cover that, and we're compliant with that section of the Act.
Has the board ever approached the minister for financial assistance in clearing up the unfunded liability?
Not during my time as CEO. I believe in the past there have been conversations, but I wasn't party to those conversations.
And you've been CEO for this
3 years.
For 3 years, okay. So prior to that, there was possibly some discussions between the board and the government at the time to.
It's been a long time since that conversation has taken place.
Okay. Okay. How are we doing?
Less than a minute.
Less than a minute. Okay. I will pass that over to my colleague, I guess.
Okay, we'll move on to the NDP Caucus. Mr. Corbett.
Thank you, Mr. Chair. Thank you, folks, for joining us this morning. I'm just a real fill-in here this morning, so I got to probably have a hodgepodge of questions. So I'll get around it. As someone who has had dealings with the board in the past and stuff like that, often it's when the worker is either injured or had a pre-injury, they're often put in a very precarious position because of I always say that an injured worker sometimes has to deal with two acts, a pre-Hayden Act and a post-Hayden Act. And for clarity, can you explain as best you can, and I call you Stuart, okay? Mm-hmm. Stuart, the difference between the two in as much as timelines and so on, and what you would call a pension for a pre-Hayden and what a pension would be called for a post-Hayden?
Mr. McLean.
When you look at our legislation, and again, this is based in legislation, Mr. Corbett, this is exactly where it is. Basically, the Act provides the rules. So there was the old Act where people were compensated based on the part of body, for example, that got injured, and it was, referred to sometimes as the meat chart at that time. And it didn't take into consideration their ability to return to work, whether or not they were losing their wages. So it was modified after the Hayden decision, which I'm not sure the exact date of the Hayden decision. I'm sure
October.
In the early 1990s.
October.
And a new act was put in place. And the new act basically allowed for compensation for lost wages. So when someone is injured, we look at what did they make prior to the injury, what did they make after the injury, and there's a compensation that takes place, and a new benefit level was introduced at that time. There were a lot of changes in the new act. For example, in the old act, it was 75% of gross was how the calculation was done. Today, it's 75% of net, based for the first 26 weeks, and then it goes to 85%. So those changes were made in the Act in the early 90s, and so that it does create some confusion because you have injured workers from the different populations who say, well, how come someone pre-Hayden is back to work and they're still getting the workers' compensation benefit? That can happen. So there are benefits. We would call an extended earnings replacement benefit is what we would call a pension, and we don't differentiate rather than they're just pre-Hayden or they're post-Hayden. In terms of, Shelley, did you have anything you wanted to add? No, we're good, thank you.
Okay, thanks for that, because where the part of the province where I come from, a lot of the injuries are on that line. There's quite a few, though, that would have been post-Hayden from the mining industry and so on, as I'm sure you're well aware. And previous to your time in your chair, it caused some consternation after the Act was changed in February 1, 96, was it? When you had people working side by side, particularly in the coal mining industry, and particularly for DevCo, when you had people on automatic assumption, or it's commonly referred to as AA, where someone would be on the meat chart or clinical rating system, and they would be getting paid this much, and the person on wage loss would be getting considerably less on wage loss. And I often wondered, and it may not be a fair question to you, but it may be a board issue too, but at that point, does anybody ever recall, was there any discussion with the board in relation to say, how do we smooth this out? I mean, I really it really bothers me whenever you see two groups, they're the exact same except for a day in the calendar, right? And one is in and one is out. And, you know, you could have the same failure in your pulmonary function, yet because they were diagnosed even, like you could have had this injury before, you could have established it before Hayden, but the test came after Hayden. So I wonder, was there ever any discussion with government at the time how we would smooth these people in? Because it's if there's any large inequity within the board, I always find is when it comes to the Hayden stuff, but no more so than that, because if I was more paranoid than what I am, then I would say that there was decisions held back, knowing full well what was going to come out of Hayden and what that decision would be. So was there ever any discussion about that?
Ms. Rowan.
So as Stuart mentioned, the change in the legislation was before most of our times.
Before mine.
But I understand that the government did consider that divide between those workers who had a clinical rating scale pension, long-term pension, and those who would receive a long-term earnings loss pension. And those decisions were made at a time when the system was in financial crisis. We've talked about the unfunded liability, and at that point, the board was only 27% funded, so significant financial issues. And so a trade-off was made that they couldn't afford to bring all of the workers who were receiving a clinical rating scale pension over to the earnings loss system. They did put in place a new benefit called a supplementary benefit that tried to make a bridge for those workers who had a pension under the clinical rating scale who had not returned to work and who were struggling financially. They tried to put in place a top-up benefit, and that was improved in 99 or 2000, I can't remember exactly the year.
99.
To increase that benefit a little bit, and in the hopes of making a bit of a bridge. But there is no question, for someone in the early days who was injured prior to 1996 who did not return to work, their pension could well be less than someone on the earnings loss system, and due really to the financial situation of the board at the time.
Thank you. I guess around just staying on the Hayden stuff, and I guess it goes to those on post-Hayden pensions, and I think Mr. McLean will probably know where I'm coming from in this one. The ability, is there any action being taken today around within the courts regarding pensions continuing beyond the age of 65? Because if you're a post-Hayden, your pension, you lose your pension at 65. Pre-Hayden, you keep it, right? So I want to know, if, as you see, there's more and more people working beyond 65, and then how do we treat these people? If they lose it now, how do we treat these people if they're injured working after 65? And do they get an ERA or whatever? Or are you anticipating, and are you kind of manning the courtroom door, so to speak, about a possible challenge on the would it be considered discriminatory or whatever to lose your pension at 65? Ms. Rowan?
There has been discussion about the termination of extended earnings replacement benefits at age 65. That benefit was put in place under the concept that most people retire by the age of 65, so the ongoing benefit would end just as my wages will end at age 65. As part of the long-term benefit, there is a small benefit for the physical impairment that if the person is getting an ongoing benefit would continue, or it would be paid out at age 65. So there's no question that we've heard discussion about whether that will be tested in the courts. We don't know what will happen over time. That the termination of benefits at age 65 is currently embedded in the legislation. If someone who is 65 is still working and they are injured, we will cover temporary earnings replacement benefits for those people. but we won't provide an extended earnings replacement benefit at that point.
I guess then I'll be more direct, because I remember when a lawyer friend that we both know gave you counsel on your chronic pain would stand up in the federal court. It didn't. Has been discussion with your legal department regarding the possibility, would this stand a legal test?
Absolutely. There's a variety of things in the Workers' Compensation Act that we know that have been discussed and tested over time. Chronic pain would be a good example of that, and age 65 is one of the things that the board does discuss.
Are you at liberty to tell us what those discussions are? What advice have you been given?
We only talk about it as a risk at this point.
So it's just a risk. There's no ongoing case. Workers' advisor hasn't ever given notice that they're bringing what we would refer to probably as a test case forward.
I'm not familiar with any case. One of my colleagues might have more information. Mr. McKenna?
Mr. McLean?
I'm not aware of any case right now that's currently forward. Leo?
Mr. McKenna?
Thank you. I don't believe that there's a case ongoing. This has been tested before, though. It's gone at least as far as the Workers' Compensation Appeals Tribunal, because I can remember being called to that tribunal to help them understand the question and offer some evidence around what costs might look like. So it has been tested before. It's quite possible it will be tested in the future.
Thank you. The issues around those that are receiving pensions, and what is the usual raise? How would you go about getting a raise? How do you calculate? Someone's on an extending earnings benefits. How do you, after they're on it for so many years, do they progress? How, by CPI, or how's that figured out?
Mr. McKenna?
Sure. So the legislation provides for indexing at half the rate of CPI. On the previous question around age 65, it's probably important to note that, as Shelley said, the legislation was, we believe, written, and we're of course not legislators, but our understanding is the legislation was written on the basis of normal retirement at age 65, and it is tied to all kinds of other government programs, some of which are at the federal level around CPP, OAS, that sort of thing. So age 65 is a very standard retirement age concept.
Well, those concepts are there too when we changed from the clinical rating system to this. So that was nothing new. None of those programs have arisen since the February 2nd, 96 or February 1, 96. I mean, that's I don't think a mitigating factor here. And just to answer that too, is the federal government now is musing about raising the pension age too, which then that is the reason I'm asking the questions, because if you're going to say you're going to react, if some of the things you're reacting to at 65, and this rolls in, and so on rolls in. So then I think you have to be proactive and say if the feds are going to go up to 67 or whatever magic number they pick, I think you have to be ready for that. I think, I'm certainly no lawyer, but I would think that someone would have a fairly decent case when it comes to regular retirement age, with air quotes, is 67, and that's what you just told me you built most of your case on here, if it changes. I don't know whether Mr. McLean wanted to respond to that, or
Mr. McLean?
I'll just say that our board typically will look at the types of decisions that can change the intent of the legislation. So you gave some great examples earlier, whether it's chronic pain or gradual onset stress, the different things that are emerging as issues across the country. They'll look at those, and we have, as you know, a legislative framework, and we need to honor that legislative framework. The rules around, for example, age 65 for our adjudicators and case managers are very clear. Mm-hmm. So the test is more of constitutional, does it actually create any disparity for people? And certainly if things move to 67, I can only assume that our board will have those conversations that are necessary to say what recommendations would they make to government, and then it would be incumbent on the government to actually make the changes to the Workers' Compensation Act, if that becomes the case.
Thank you. Look, I sometimes wonder why you guys, and I'm talking about yourself on down, the employees through, don't go ballistic down on South Street, because it moves me into another part of my question. You do, and I agree with you, that you do have legislation. And then on the other side, you have board policy. And so that's on balance. You have, when there's gaps in the legislation or perceived gaps, and then the board is left to its devices to say, you know, that's the intent, so we're going to put a policy, and I'm not being fairly doing that much as a drive-by, not giving it much on that. But the reality is that many times you see decisions based on board policy because they feel that that the legislation itself doesn't really cover the situation. Is there much discussion between, after that rises up and the board chair, we'll just say that a meeting takes place between the board chair and yourself, Mr. McLean. Is there much asked there between the board chair saying, look, Mr. McLean, we've got to go down to see the minister and say, like, you know, that we're wandering into an area that is really legislative and not policy? And does that happen? And if so, does it happen very often?
Well, as you know, there's a collaboration that needs to take place on policy with our stakeholders. So we go to our stakeholders, first of all, to say what are the emerging issues that people believe are controversial. We also have lots of input from our staff, our adjudicative staff, our case managers, where they say we have difficulty, we need clarity. And our board weighs up and consults on. In fact, we have a policy even about our consultation process, which clearly defines how we have the conversation with our stakeholders, how the board develops its policy agenda, and then how those policies get approved and vetted. Those policies, as you've mentioned, are actually binding on staff, just the same as the law is. The statute actually calls for that it actually is filling in the details of the legislation where there are areas of ambiguity. The example earlier, I think, is very clear. So if there's really a lot of clarity, we don't, like if this section says we don't cover beyond 65 for wage loss, and that is not being tested, and we don't need policy to understand what it means or for adjudicators to make their decisions. That's a legislative conversation. Does the board engage in conversations with, and the board chair, in terms of the priorities of the board, what the board is talking about, what they think the current issues are? That absolutely does happen with any government that's in play. Also, we have regular meetings with the Advisory Council, which provide advice to the Minister of Labour on the state of occupational health and safety in Nova Scotia. The chair visits them once a year. They visit our board once a year to share their priorities, and those priorities are then written up in the state of occupational health and safety, a report, which is tabled to the Minister of Labour on an annual basis. So there's a lot of communication that takes place around our policy agenda, what the emerging issues are, what the challenges are, and it can be a very difficult thing to get a legislative mandate to change in workers' compensation, just by the nature of the complexity and the fact that it's going to be controversial, whatever you do. So those are some challenges that we deal with. But we fully understand the priorities of our stakeholders and understand where they would be on these different issues, because we try to keep strong communication channels open at all times, so that at least the minister and the current government understand the priorities of where people are and what they would like to see if the Act actually gets opened up.
Thank you. I'm going to do something really strange and ask you one about the topic of today.
Yeah.
And association fundings. I realize one of the areas that had a growing accident rate was in the healthcare sector. So how does an association really help drive down those accidents?
Well, associations work in a number of different ways, and first of all, I think the important thing about them is that they're industry-led. So they further understand the things that go on, and use the healthcare example, but I'll just give you a couple other ones. If you're in the forestry sector, they're going to be the best ones to give you training on chainsaw use. If you're in the construction sector, confined space, fall restraint, those are the types of things that they would focus on. And in the healthcare sector, you need specific information to get to those committees, the JOSH committees. And I mean, it's a big organization. It's over 20% of the payroll base that we assess on is in healthcare. So it's big. We have lots of time loss injury that's taking place there. And where Nova Scotia, for example, while it doesn't have a lot of resources, they need to be strategic. So they have online training, they have websites, and then they basically get the message out to the individual JOSH committees that exist through the acute care sector, through community care and nursing homes, et cetera, to basically get the messages out. So in essence, what they're trying to do is enable people to create those health and safety environments in that sector by taking an investment from the Department of Health, finding out what best practice looks like, and making it available to people. But there's different, in each of the different safety associations, they have different spectrums. The construction sector...
Order, the time has expired from the NDP Caucus. We'll move to the Liberal Caucus. Mr. Stronach.
Thank you. I guess got a few questions that kind of lead into three questions in total. I guess what is the total cost of WCB to run?
Just give that to Leo.
Mr. McKenna.
Thank you. Are you asking what are the administrative costs, or what is
The whole kit and caboodle sort of thing of running the WCB?
Sure. The total cost in 2013 were $437 million.
And I guess from that, how much of that is collected from businesses?
The assessment revenue in 2013 was $296.8 million. I suspect your follow-up question is, where does the rest of the money come from?
No, actually, it's not. My really, as a small business owner, I'm kind of trying to see where the value, like for small businesses, every bit of nickel counts. So I'm making sure that what are you doing with that money to support the smaller guys in this? Because there's a perception that you're mainly focused on large businesses. So what are you doing for small businesses within that?
Mr. McLean.
Thank you for the question. Small and medium businesses make up about 40, the way we would define them, would make up about 40% of our payroll base. And there's no question that in the workplace safety strategy, the previous prevention strategy that we had in play, that a lot of it, our focus was getting the economies of scale in the 350 or some odd companies that have the other 60%. So they needed, so this is about customization. So enabling the companies with coaching best practice to see success in those organizations. And I think that's one of the main reasons why we've seen a lot of the success. Small and medium business struggle because typically they statistically have an injury once every 7 years. Yeah. You need to pay premiums, and you're paying premiums, they're going up, they're going down, you need to understand it. So the needs are very different, which is why we have to have a different approach. In the workplace safety strategy, we talked about, and we heard from employers that we need to do something different for small and medium business by creating online toolkits and different information that will be fundamental to helping enable their success, because their challenges are different. And we're working with the Department of Labor and Advanced Education for different ways to show up. And I'm going to turn it over to Shelley, because she's our VP of Operations and led the implementation of that strategy. Maybe you could just give a little bit more detail.
Ms. Rowan.
Sure. In terms of the workplace safety strategy, as Stuart said, we heard from small businesses in particular that the web of regulation that small businesses try to follow is very confusing. And to try to read the Workers' Compensation Act or the Occupational Health and Safety Act is really daunting to understand your role and responsibilities. And so within the strategy, you'll see that we have some initiatives to try to make information more accessible and easier to understand from the point of view of the small and medium-sized business. So we're starting to build some of those tools already. We have a brochure that we've prepared that gives the highlights of your health and safety responsibilities. And next, we're going to go to a toolkit that gives a small business owner a few tools to understand how do they meet their responsibilities. On the workers' compensation or claim side, as Stuart said a few years ago, we kind of split our claims management system and had a focus on large business and a focus on small and medium. And we know that the needs of those two kinds of businesses are very different. Large businesses have infrastructure. They have health and safety people, they have human resources people, and a small business owner is trying to do it all themselves. And there's challenges in trying to return somebody to work in a very small workplace. And so we've added a workplace consultant who's now accessible to small businesses that could give them some support. And we're looking at our return to work model to see, is there anything else that we could do in the way we provide service that's different than how we do it for large businesses that might help support the small companies who, in terms of trying to get somebody back to work, knowing they just don't have all the same resources that a large business would have. So we're early days in that.
Okay.
And we understand the frustration, and we're getting to better understand the need and try to see where we can help to try to support small and medium businesses in a different way.
Mr. Stronach?
No, again.
Mr. McLean?
Yeah, I'd just say also from a national perspective, the AWCBC has a prevention committee, and this is an issue that right across Canada, people not only struggle with, but we're looking for ways to learn from each other on that. So any of the different modalities or the different things that the people are doing, we're going to try to bring them back to Nova Scotia and learn from them. We had a forum, in fact, when we had a leadership forum last fall. We had a special session for small and medium business to talk to leaders in those sectors about what the issues are, because first you have to understand what challenges people are having if you want to be responsive. But there's no question that the challenges are different, and we've made it a priority in the strategy to step up to trying to enable the success of small and medium business in a different way.
Okay.
Mr. Stronach?
Thank you.
We'll move to Mrs. Miller.
Yeah. Good morning, and thank you for coming in. I've had a long-standing relationship with the Workmen's Compensation Board, actually as an employer as well, in the dairy industry and then later on in the forestry sector. And I can remember those first days, and this would be in the 1970s, 80s, early 90s. It was almost an adversarial role. Like, it was a hardship being involved with Workmen's Compensation Board. Later on, during the time that we were in the forestry sector, I found a real change. You know, I would call the Workmen's Compensation Board or the offices over certain issues and things, and it was very easy to get answers, very good responses. And even now, as an MLA, calling the Workmen's Compensation Board on behalf of constituents, I found the responses have been really, really great. But my question to you is how did that, you know, what brought about that change? I mean, I can remember that somebody coming in and telling me that their husband worked for the Workmen's Compensation Board, but he didn't tell anybody. You know, he was just said that he worked for the government, and that was it, you know. So, you know, what has changed this, why the shift in attitude and the change in profile with the board?
Mr. McLean?
Yeah, thank you for that question. We see in our business, we recognize it's a business of influence. And just to give you an example with that, the claims are taking place, but they're not taking place in our workplace. They're taking place in the workplaces of employers. It's happening to people, but we don't have direct supervision. So we have to be influential. Our board, well, first of all, we got the prevention mandate about 10 years ago. That was very helpful in changing from being an organization that pays claims and works just to get people back to work to being more of an organization that has a specific orientation towards working with others. In the most recent version of the strategic plan, we're just about starting our next strategic plan now. We're in the midst of having those conversations. But the last strategic plan, the board actually added a goal, working with others, and they added another goal called, in terms of public confidence. And those two goals, they go together to say we need to show up in a different way. We need to enable, we need to know people, we need to be known by those people. We implemented a new service delivery model during that period, which allows us to have understandings of the different challenges in different industries, as an example. And also, we work very closely with the injured workers associations, the Office of the Workers' Council, the Office of the Employer Advisor, all kinds of infrastructure has been added to try to improve communication and navigation of a very complex system. The system is complex, we understand that, but how we show up. We also added values so that each one of our organizational employees understands that they need to be caring and compassionate, they need to have a can-do attitude, they need to be safety champions, and we want people to be proud of the value proposition that we bring. With the prevention mandate, one of the first questions we were asked, I would say to staff is, how are we going to show up for anyone and say, well, we can help you? So that was the first question for us, and we needed to develop tools, find out what best practice looked like across the country, and we needed to move from, again, being a bit reactive to being more proactive in trying to find creative, innovative solutions. So I think, you know, I can't speak too much about what happened, you know, more than 30 years ago. I know I've been with the organization for a long time, and I understand that what you say is real, that people were ashamed to work there at one time, or afraid for the political, you know, if you say I work there, then what you're going to be in the corner talking to the person for the whole night and not necessarily be a positive conversation. Today, I believe our employees are proud of the work that they do. They see the impact of what they do. Is there hardship? Do we need to do better? I think we're aligned by the purpose that all of us understand that getting people back to work and preventing the injury in the first place is what all of us want, right from the politician to the people who work with us, to the people, if it's an employer, a labor community, the injured worker groups. Everyone understands that the prevention mandate is important. And that's where we've put a lot of extra effort and energy. And I think it's actually changed the way people see us and think about us. And we've tried to become better at communicating, online tools, facilitating and enabling the success of others has been a key focus of our board. So we want that to be the way we're perceived, and I'm happy to hear you say that.
Ms. Lones-Croft.
MLA for Lunenburg, going to talk about fishing.
Oh, great. My favorite topic.
Okay. Why is the WBC focusing so heavily on the fishing industry?
Well, that's a great question, and it relates to the fact, I'll just go back to last year as an example. Last year, we saw more than 5% reduction in time loss injury. You know, thousands of days were removed from the system in terms of people getting back to work in a safe and timely way, but we are seeing improvement. And when you looked at the fatalities, we had 34 workplace fatalities last year. And when you look at that, 17 of those were what we would call an acute fatality, or something happened to the person in the workplace. The others were health-related or occupational disease-related. So when we look at the high nail in all of that, because to me it's an unacceptable number, to have one fatality is a tragedy for a family, for a community. And in the fishing sector, we actually had 8 acute fatalities last year. We'll all remember the Miss Alley disaster that we can never forget, but we also had a fall from height. We had someone drown off the end of a wharf, and you put these things together. We had a young man lost off the end of a boat while they were steaming back to port. So you look at these things, and they're fundamentally unacceptable. So in conversations with the Department of Labor and Advanced Education at the time, we decided to implement the fishing safety strategy to try to raise awareness. We see an industry that's struggling with high levels of fatality, but also severe injury and a high frequency of injury, which results in high workers' compensation costs. And you know, the MLA who just spoke about forestry and how that's changed, and high rates have now changed to low rates. We need to facilitate the same type of thing in the fishing sector if we want them to be a vibrant, strong, with the people in those communities. The hardship needs to stop. One doesn't have to look any further than monuments in each of these little communities to see how many people have been lost. We have a rich tradition of fishing, but it can be different, and we need to believe it can be different. So wharfside demonstrations on getting people back into the boat. PFD use is on the uptick, so we're seeing a lot of that, and we're supporting the Fisheries Safety Association in their work. It's an industry-led safety association, and we believe that it's important for us, both in our social media and with our tools and resources, to recognize that there's a big difference we can make there. When you have a great year and you say, but this is the problem, the high nail in this particular circumstance is in fishing. They need our help, and we need to respond.
Sloan-Scroft?
There seems to be a lot of resistance from fishers. You know, I've met with many over the last couple of years. You know, they find it, safety equipment impedes their work. Some just feel uncomfortable wearing, you know, survivor suits, but there's also the cost. It's very expensive for fishers who are, you know, sometimes going, you know, sail to sail to provide a living for their family, to add all this expensive equipment, although it is a safety issue. But is there any thought to that?
Mr. McLean?
When we try to quantify the cost of a life jacket or a life raft to the cost of a human life, you know, to me, I think the connecting of the dots there is what needs to happen. And certainly, I don't think there's any fisherman that would not want to come home safely to their family. I think that, or care about their crew. I know that they have, this is a rich tradition they've been around for a long, we've been fishing for hundreds of years in this province. And, but the fact of the matter is, you can say it's uncomfortable. We had all the same conversations in the forestry sector around chainsaw pants and the visors, they steam up, and the helmets, we shouldn't have to wear them. But you can't have somebody in flip-flops and a bathing suit operating a chainsaw. And you could say, well, you know what, the chainsaw pants cost a lot of money, and so does the visor, and so do the ear protection, so do the gloves. But it's fundamental. They shouldn't be operating in that industry if they're not willing to create a safe work environment. In fact, it's covered under the law. And we need to change the attitude towards that. If we can get fishermen to move from knowing about it to saying, you're not going to be able to step on my boat unless you're wearing a PFD. And we're seeing examples of that success across the province, where we, you know, man overboard demonstration in Wedgeport at the recent tuna festival. Well, there's probably over 300 people on the wharf watching the man overboard demonstration, cheering when they get the guy back into the boat, the fisherman who's gone overboard. And to me, wearing PFDs, and these were not new PFDs that were on these guys, they were worn PFDs. So we see it. We see whole communities that have surpluses in funds that are now taking those funds and directing them towards buying PFDs because they want to raise awareness. So we're seeing a groundswell. We're seeing organizations like Camo Seafoods who have made a safety charter, and so everyone on their boat have permission to only do something if they can do it safely. And the expectation is, when you're on deck, you're wearing your PFD, and that is the way you work. It's uncomfortable. Maybe it's not convenient, but the fundamental thing is 8 people in this province lost their life last year in the fishing sector. This year, there's been 2 already. And that is a statistic that we can change. And in fact, we've had 3 acute fatalities this year, which is, you know, we can't take credit for it because last year the number was 17 at the end of the year. This year we're at 3, so we're very happy that the number has come down. But as long as there's 1, that's going to mean that we're going to have to do everything we can in our power. Now, why it's so important, that, coming back to your first point, that we support the Fishing Safety Association, that it's industry-led, that there are HR sector councils involved, and that when we make changes or we try to make changes to create those conditions for success, we do it with the fishermen, not to the fishermen. That's critical because we need acceptance, we need culture change, and we need to have the voices to say, this can be different. And we've seen the examples of it. Now we need it to be widespread practice.
Ms. Sloan-Scroft, 2.5 minutes remaining.
We've all seen the horrific accidents that have happened on trawlers and whatnot. But what about the wear and tear on the body over a long, you know, many of these fishers started at age 13, 14, going out to sea. You know, by the time they're in their 40s, their bodies are pretty disabled. Is there any workers' compensation program for long-time wear and tear?
Well, that's a question that is not just a fishing industry. If you were, you know, you're making rail cars, or you're in construction, all of us over time are going to age, and that makes it more difficult to heal when you become injured. But I think what that speaks to is safety culture. That if you create an environment where you don't have repetitive strain injuries, if you create an environment where if someone needs to lift, you find ways to assist in the lifting, where you look at engineering solutions, where you look at, this is what injury prevention is about. And I think your question actually extends to occupational disease, because the things that we pay for today, there's new things that are happening today that we'll pay for tomorrow. And it's not just it's not the money part of it, it's the toll on the people. So we have a legacy in Cape Breton, for example, from coal mining and from tar ponds and all the other things that go along with that. Well, we need those things to be different in future generations.
14 minutes.
So it's not just wear and tear, but I think we can do things about wear and tear if we work differently. But it's got to be comprehensive. And creating a safety culture is about thinking about all of the elements in the workplace and how do you protect people. Hearing protection would be another great example. Not widely used, perhaps, but we know that it's been in the news lately, just in terms of the veterans, and we have hearing protection issues as well in workers' compensation. Would we like to prevent them? Absolutely, but it's got to start with the behavior. So there are things we can do differently, and we need to find ways to get to those.
Okay, thank
Ms.
you.
Lonscroft, you have 20 seconds.
I guess I could ask, what about retraining possibilities to get people off workers' comp who have permanent injuries and whatnot? Is that a possibility?
In 10 seconds or less, yes, it's a possibility. Yeah, so we do try to facilitate someone getting back to the work, especially when they're permanently disabled.
We'll have to move to the PC caucus, and you have 14 minutes. Mr. Houston.
Thank you, Mr. Chair. My question's for Mr. McKenna. I'm just wondering if the surcharge system is unfairly punitive to small business. And I'm thinking about if you take the relationship between claim costs to payroll ratio and then compare that to others, it just seems like if you have a small payroll and you have an accident, you're going to get hit with a surcharge. And I'm wondering how much time the board spends looking at how they kind of reconcile that.
Mr. McKenna.
Thank you, Mr. Chairman. Yes, we thought a great deal about that in the design of the program, because you're exactly right in terms of that ratio can be quite different for a small business. But in order to be affected by the surcharge, your experience has to be very poor relative to your industry, not just for 1 year. It needs to be for 4 years. And so because small employers have smaller workplaces, fewer people there, they don't tend to have injuries every year. So even one serious claim, while that can give a small employer a very high cost ratio for that year and perhaps the following year, that one serious claim is not likely to...
because you feel like the 4-year
exactly.
average mitigates that?
Exactly, yes.
Okay. Is that something you hear much from small business owners about?
We certainly heard the concern when we first talked about the program, and we've explained that in a number of forums to people. And generally speaking, when people understand how the calculation actually works and see it in practice, that concern is mitigated.
Okay, maybe I'll turn over to Ms. Rowan, just about like a same kind of theme, like in a small business. I guess in a larger business with a larger payroll, you can kind of maybe, let's say, hide accidents or absorb them, but in a smaller payroll you can't. And how do you feel about the experience rating system in terms of, so I guess what I'm trying to get my head around is the size of your assessable payroll. It's not really an indication of how safe or unsafe your workplace is. So I'm wondering how you kind of reconcile that. Is that something that you've thought about? I mean, just because you have a big payroll doesn't mean you're a safe place, and that's kind of how some of the ratings seem to work.
Ms. Rowan.
The experience rating program provides either we call it a merit or a demerit for workplaces if their costs are higher or lower than the industry, than their industry. And so large companies can receive a merit of up to 30% on their rate or a demerit of up to 60%. And that is significantly lower for small businesses. So we've tried to, while we've kept the same concept, the range is lower for small businesses because we know their payroll is smaller, their risk is different, and the frequency of injury would be different. So we've tried to build the program with that accommodation for small business. Just as Leo said, we tried to build the surcharge program, understanding the impact on small business. We did the same with experience rating.
So it's the range is smaller for small business.
Yes.
So it's, I guess, in theory, easier or more likely that a small business would flip into either the merit or the demerit category because it's a tighter band.
Actually, the cost impact would be smaller. So the demerit for a small business
Okay.
would be smaller than a large business.
Okay, I may come back to that, but in the interest of time, stick with Ms. Rowan as well. And I'm just wondering about, is every licensed physician in the province of Nova Scotia capable of providing information to the Workers' Compensation Board? So is every licensed physician, do they have the knowledge and experience to provide the board the information that they would in theory need?
Ms. Rowan?
We don't license physicians and we don't test them. That's done by the medical schools and the College of Physicians and Surgeons. They're the ones that actually regulate that. We do business with most family physicians and many specialists in the province. And we believe that they're capable of many things. There are things that they are better at than others. And so there are some things that we would rely on a physician for in terms of advice and information, and others that we might rely on other health professionals for. The same as we would do in our regular life. There are some things I would go to a specialist for, some things I'd go to a family physician. So depending on what information we require, we might go to a different healthcare professional.
So I do have constituents that come into my office and have, maybe their family doctor diagnosed this, and some other doctor that they've been sent to by the board says something else. In fact, I have one case, and there's a couple like this, but one that's particularly troubling. I mean, he has 3 doctors that have determined that he's not fit for work due to a concussion. And he was then sent to one doctor by the board who said he is. So I'm just wondering how something like that happens. I mean, if the board relies on the College of Physicians to license people and hold them to a standard, how it is that the board would and say, well, these 3 opinions from the same professional body aren't relevant to us, but this one opinion is. And how does that happen? In the balance of probabilities, you would think that maybe the 3 has some merit. So how does a situation like that happen?
Ms. Rowan?
In most cases where workers are injured, they seek health care from a physiotherapist, from a physician. It's pretty straightforward and they go back to work. We do have a few cases that are more complex, and with complexity comes a variety of healthcare professionals generally. People they get a lot of tests, they get a lot of medical opinions, and it's the work of the caseworker with the support of a medical advisor who's also a physician to weigh that medical evidence. And so they take the variety of opinions and information that they have from a variety of different sources and weigh that to determine what part of the injury, or did the injury arise out of the course of employment, and so what would the Workers' Compensation Board actually be responsible for compensating? And there's no question there is complexity in all of that.
So you mentioned it's the responsibility of the caseworker alongside, I think you said, a medical advisor. The medical advisor is an employee of the board?
Yes, medical advisors are contracted with us, yes.
And how many are contracted with you? So they have their own practice, but and they also do some work for you guys. So how many caseworkers would you have roughly?
We have about 80 caseworkers.
And how many medical advisors would you have?
We have 8.
8. How do you become a medical advisor to the board?
We recruit medical advisors. You have to be a physician. We look for people who are interested in working part-time generally. We have a couple who are full-time, but predominantly we're interested in people who work part-time. We advertise for them and do a recruitment process the same as we would for any other.
And how are they compensated?
They're compensated, they're either employees or they're compensated by contract.
Yeah, the medical advisors are contractors?
Yes.
All 8 of them?
No, we have a couple who are employees who've been with us for a very long time, and the rest are contracted.
And the contractors are compensated by case or by time or?
By time, yes.
By time, okay. So the medical advisor is getting these, in my constituent's case, I guess, is getting those 3 opinions and assessing them and coming up with their own opinion.
The caseworker would collect all of the medical information on the file, and the medical advisor would review that and provide an opinion, and then the caseworker would weigh that and make a decision. It's the caseworker's responsibility to make the decision in the end.
So what percentage of cases end up in appeals? There's an appeals process. What percentage end up in appeals?
It's a relatively small percentage. We probably have on claim in any one year about 10,000 people active claims, and we receive at the internal appeals level about 1,800 appeals, probably half of those from people who are in active case management as opposed to in a long-term benefit. And the external appeals tribunal, I think it's about 900 they had last year.
So 10,000 claims, 18 end up in internal appeals? 1,800, sorry, so 18%, I guess, or whatever that is.
About half of those are from the 10,000 claims. So
Okay.
I'm ballparking, but so we'd have about 900 appeals from people in active case management.
Okay, and have you done any analysis that looks at like a certain number of cases that proceed to appeals? Can you track them to certain medical advisors?
We do keep track of, by caseworker, by team. We do know where all the appeals come from, yes.
By caseworker, by team, so the same medical advisor always works with the same caseworker, is that the team?
Generally, yes.
Okay, so I know Stuart talked a little bit about the can-do attitude and stuff, and I'm just wondering, how does it work internally if you find a team that has a high number of cases heading to appeals? What do you look at that? Do you talk to those people? Like, what's the process internally? And I see this all as being tied into prevention.
Yep, absolutely. We do review appeals that are heard at both the internal appeals level, the Workers' Compensation Appeals Tribunal, at the Court of Appeal, and we try to learn from that. So what happened through the appeal process that was different than what we had at the initial adjudication? Did they have the same information that we had? Often new information comes forward through the appeal process. And what can we learn from the outcomes of those appeals? So yes, absolutely, we look at all of that at an organizational level and then at an individual team and caseworker level.
It seems like a high number going to appeals. Do you feel like that's a high number of cases that go to appeals?
The appeal rate in Nova Scotia is higher than it is in most provinces, and we have a system that provides support to injured workers. Most of the appeals come from injured workers, and we have a system that provides them with support through that process. So I think it's just the way that it's always been. It's the same, the way it's been the whole time I've been there. We talk to our colleagues across the country, and they do remark that our levels are higher than others, but it is the system that we have.
Oh, I find that hard to accept, to be honest. I mean, if you're lagging behind the rest of the country, I would hope that you'd be looking at why. And I just wonder if, what's the turnover in the medical advisors? Do they become a medical advisor to the board, and that's kind of part of your gig for your working career, or do they turn over? Do you get applicants every year? And it seems like something that it's probably a lot like a politician. You probably have a shelf life in terms of being a medical advisor, and I'm wondering if the board would see it that way too.
Yep,
Except for Frank. Frank has no shelf life.
I just don't know. I've been stale for a long time.
I don't want to comment on your shelf life, where angels fear to tread, but we do have turnover in our medical advisors. We have a couple of new ones that have started this year, so we have a few that have been with us for a longer period of time, and we have some that have been with us shorter. As with any employee base, we do have some turnover.
The reason I'm concerned about the number of cases going to appeals is, I would think for the most part, by the time you get your appeal date, your benefits have been cut off or you've already been declined benefits. And that's a pretty stressful thing for people. So if we can't accept people unnecessarily having to rely on the appeals process to get what might be rightly theirs.
Absolutely.
And that's a big concern for me, because I believe that maybe happens a bit too much, and particularly when you compare it to other parts of Canada. So I would hope that you would be taking a serious look at where...
Order. Time's expired for questioning from the PC caucus. We'll move back to the NDP caucus for 14 minutes. Mr. Wilson.
Thank you, Mr. Chair, and thank you for coming today. I'm going to kind of stay on the same line of questioning around casework and active claims. You've mentioned about 10,000 active claims now and have about 80 caseworkers. Do you feel, when I was trying to do the math on how many claims per caseworker, it's quite a few, and going through some of the material that was provided to committee members, I noticed there was like 18 vacancies currently. A number of them, I think I read, and I tried to find it but couldn't find it, read that there was some caseworkers vacancies in your department now. So is that a manageable caseload for these caseworkers to have that many claims, and especially where we do see a high volume of them being appealed, and that's usually when my office over the last 11 years have been contacted, is when there's those delays or they've been denied, and they're concerned they don't have an income. Is that a manageable caseload, or is that something you're trying to address?
Ms. Rowan.
Yes, this is something that we monitor regularly. So when you look at the new claims that come in a year, in 2013 we had about 6,000 new claims, time loss claims, and about 80% of those, the people return to work within 10 weeks. And so most pretty straightforward, and they would need some support from us, but relatively limited. The remaining 20%, which is about 1,000 claims a year, are ones that are more complex, and those claims, those workers and workplaces would get a more senior caseworker. So when you look at the numbers, while we have a large number overall, they are spread over the complexity. So some need more effort than others. To that end, we think we have the right ratio, the caseworker to claim volume ratio. But it is something that we monitor regularly. We monitor it on an organizational level, on a team level. So does one unit have more claims than others, because claim volumes go up and down, and then at an individual caseworker level. So because we know the level of service that you can provide is affected by the volume of work you have before you. So we monitor that pretty carefully.
And by no means, I know when individuals call my office, it's usually because they haven't heard anything or there's some kind of delay. I want for the record to say that our contact person, Mr. McGuinness, has been very, very active in getting back to us and taking on our cases as I think the government relation kind of point person. So, and I know he's in the audience upstairs, but I must say he has been very responsive when our office calls. So I am concerned. Hopefully you'll be looking at filling those positions, or are you holding off filling those positions over the next year or so? Is that I know there's some number of vacancies that usually happen, but are you looking at filling some of those vacancies to make sure that people are getting the response that they need as quickly as possible?
Yeah. We are currently we're generally at full complement. We do have turnover within the organization. So at any one time, we can have vacant spots, but we're pretty active in getting them filled. So it's generally a point-in-time thing. So we don't have any large vacancy right now.
All right, thank you. I just want to turn now to something Mr. McLean had mentioned in a previous answer to my colleague. And it was around looking at emerging issues across the country when it comes to issues, and having to maybe look at board policies compared to legislation. I know in my time here, changing legislation does take time, but policy can be changed quite quickly to adapt. In my background, for example, as a paramedic, more recent awareness around PTSD, around military personnel, but of course those areas or those professions that find that this is emerging as a serious issue, EMS, fire, police, correctional services. What's the policy, the board policy on PTSD? Do you recognize that as a workplace injury for workers here in Nova Scotia?
Mr. McLean.
Thank you. PTSD is typically associated, or a lot of times is associated with an acute reaction to a traumatic event. And we would compensate a worker in a circumstance where post-traumatic stress disorder is arising out of in the course of employment. If something happens to that individual, like say for example, a prison riot or different things can take place, and then they can't work, then that's certainly compensable. Our Act contemplates for that. What the Act doesn't contemplate for is the gradual onset stress that takes place a lot of times. I don't want to speculate on how that could manifest itself, but there is recently, over the course of the last year, we've been actually consulting with our stakeholders on stress, on the trend in BC. There was some changes to their legislation, and which brought a bunch of questions up, and to the point that now that there's a Court of Appeal decision that we're waiting to hear on in the next number of months, which will give us some more clarity on how stress is compensated in Nova Scotia. The policy direction, the policy was the consultation, and was really meant to give what's the board's position, how does the board see the issues. So we had input from labor community, from employer community, injured worker community, and the board has considered those things, but that decision will take place in the next couple of months, and then that conversation will be continuing.
Are you aware of any workers currently having a claim under PTSD here in the province?
Yes.
I know you can't give specifics.
Yes,
but
yes, I am aware of that, yes.
So
Absolutely.
there are.
Yes.
Okay. And the concern is, because I read the policy and tried to make sure I understood, and I think your interpretation of it is correct. It's those acute reactions of a traumatic event. And I give an example of, say, maybe a bus accident, and there's many casualties, and that can play on emergency personnel. But it's a cumulative stress of call after call after call. My own personal experience of that, it's not an easy thing to deal with death and dying, and a lot of EMS, fire, police deal with that on an ongoing basis. So I'm concerned that we're not in a position that we can address that. Hopefully, I'll keep the pressure on. Hopefully over the next, you mentioned next couple months, you're looking at maybe bringing a policy change forward, or is it something that you think we need like legislative change to address?
Mr. McLean.
Yeah, there's a decision before the Court of Appeal where we'll get clarity, right? So once that decision comes back, that will provide an interpretation by the courts of what our law says, what the decision was, what that would do, and that will inform decision-making going forward. So it's not just Nova Scotia, but other jurisdictions in Canada are looking to this decision through our Court of Appeal, which will give us some clarity. But again, the Act is complicated, these situations are complicated, and is it multiple acute reactions, or is it just I don't like my boss? Those are two different things. And we need clarity for our adjudicators and our case managers. That's what the policy does, gives them the how, so we're consistent. As Shelley mentioned, there's lots of people making decisions. We need consistency, and we need to ensure that injured workers get everything that they're entitled to. That's important to us, just like it's important that we don't pay for things that are not contemplated under the Act. So we're looking for clarity out of the Court of Appeal, and then our board will take that decision and look at the meaning of what that means to our policy, and that'll be on the agenda for a conversation.
Is there any timeline on the decision from the Court of Appeals?
There is. Shelley, do you know the date?
Ms. Rowan.
The the case will be heard in December, and then it'll take the court, I suspect, a number of months to actually render the decision. So we're a few months away, I suspect.
So you've mentioned that you are aware of individuals, workers in Nova Scotia, having a claim open or being paid a claim through that. Are you aware of any that have been denied a claim because of maybe it not falling under the policy of kind of that acute reaction of a current event?
Mr. McLean?
I don't think, I can't really comment on whether we have claims that are open or been denied, or I have no doubt that there would be some that would be denied, or there'd be some that have been paid. We have such a wide diversity of different problems that manifest themselves, that arise out of the course of the employment, where people have been have had, you know, trauma in their lives and have stress, and that manifests itself in many different ways. Claims are complex by nature. A lot of times you may have a soft tissue injury. You've got a healthy person that feels great, and they hurt themselves, they hurt their bicep or whatever, and then that gets better and they go right back to work. But oftentimes these claims are complex in that they call it the biopsychosocial model. So there's the biology element of it, but there's also the psychological element, and there's also, is there a job to go back to? Or what does it feel like for an injured worker to come back into the workplace and not be able to do their job? You know, you have to do something less than your job, and there's peer pressure. It's complicated in all these circumstances. So we'll see a whole range of these things, and I think it would be very difficult to comment on at a very high level to say, have we turned one down or if we made one. They're all different and need to be adjudicated on the merits of the individual case.
And I respect that, but I think of my first question when you said, when I asked, are there any claims, you were quickly to say yes.
Well, I know some individuals that are being compensated for that. You know, I can think of one fisherman, for example, who lost family members when their boat had overturned. You know, I can't speak of which claim that is, but I know for a fact that that person suffers from post-traumatic stress disorder, and they're compensated by our organization. Yeah. So I know that it exists. That's why I was quick to answer that question.
Okay, thank you. I know you also mentioned, and I wrote this down, occupational disease. Is that a defined term within the legislation, or is it a defined term within policy, or is that just something that I know you were trying to give a good answer to a question?
Well, the answer is yes to your question. It is defined, but it's also defined in policy. We have policies on everything from what's a presumptive clause on cancers, as an example, or what about presumptive in terms of lung function. There's all the things that Mr. Corbett referred to earlier that have affected coal miners. There's special provisions of the legislation that deal with that. There's also then governing policy, which would dictate how someone gets tested, how we would actually pay those benefits. So industrial disease on its face is something, it's a condition that has a long period of, it takes place over a long period of time. So you wouldn't call industrial disease if a gun went off and somebody's ear now doesn't work. That's not industrial disease. Industrial disease is when they can't hear after being subject to machine noise over a long period of time. And that can be lung function, it can be cancers, it can be hearing loss, all those different types of things. So there's lots of different types of things that we look at that we have to deal with. We have a specialized adjudication unit that deals with industrial disease claims because of the complexity of it. And these are the things that we need to prevent for our future, as I mentioned earlier.
I appreciate that, and I would say, I would think an individual who, over time, you know, has been exposed to some of the situations that EMS, fire, and police have seen could fall under that occupational disease. So I hope over the next little while that we, as a province, can be more proactive. I understand precedent is important when you change policy, but I think realizing doing the right thing and supporting workers, that we can be leaders.
Time has lapsed for questioning from the NDP Caucus. We'll move over to the Liberal Caucus for the final questions in 14 minutes. Mr. Maguire.
Thank you very much. I want to thank all of you for appearing before us today. For those of us that have worked in skilled labor, we have a very unique perspective when we drive by a job site. I find myself scanning job sites looking for safety infractions, whether it's improperly sloped trench or roofers without the proper harnesses. So I kind of want to switch gears. I want to talk about what you guys are doing on the preventative side. So we see a lot of fly-by-night companies that appear, I don't know, spring, summer, winter, fall, they're always appearing. Whether it's a roofing or a framing or landscaping company. What are we doing to properly educate the employees? Because in my riding, what I'll see is you know, Jason, who is a framer. He'll work for XYZ company this year, and then that company goes under and he goes to the next one. So what are we doing to ensure that they know what their health and safety rights are with these companies?
Thank you
Mr.
for that.
McLean.
Yep, thank you, sir. Well, first of all, I would like to say anecdotally, we understand acutely the impact of this. You don't have to look back further than the Fraser fatality that took place last late fall, just before Christmas time frame, when off of a building where it appears, you know, there were problems in terms of training and fall restraint, et cetera. Now that's under investigation, so I don't know the intimate details of that, but I can tell you that the construction sector treats this particular issue very seriously, that they're passionate about the training that they need to do. The new fall restraint regulation shows that government actually treats this as a priority as well. So there are new regulations in place. There's a role for the Safety Association, particularly in construction, where they do fall restraint training, and that's one of their specialties, that people get the mandatory training that they need to operate at height and recognize that they need to be tied off when that is and when that isn't. We have to be careful as people driving by. We're very happy that you would see something and report it to the Department of Labor, but oftentimes they'll see the harness, but they can't see the rope, and they are actually attached, is what the inspectors find when they get there. Are they at the level of compliance in the sector that we probably would like to see? No, I would say that there's always room for improvement, and you just have to look to the fatalities that have taken place in that sector. Anytime someone falls from height. But I would want to make the point that this is not something that is specific to the construction sector. Anybody that works at height would be subject to those same regulations if you're going to be working. So people cleaning windows could be the same thing. In fact, we had a fatality in the fishing sector, which was off of a swordfish tower last year. So we see that those things can happen, and I think that there's a lot that's being done in education through the safety associations. There's also something called the internal responsibility system, and that's something that I think we need to push for all Nova Scotians to understand. It's one of the things we talk about when we get in front of public bodies and groups of people, and that is people have a right to a safe workplace, and that means that there's a role for the employer, there's also a role for the worker. The three rights under the internal responsibility system is the right to know, the right to participate, and then probably most importantly, the right to refuse unsafe work. And if people get to a place where they understand that there is no harness and they expect me to work up there, 10 stories up and go out and do this type of activity, that without the harness, that they should refuse to do the work. And the right to refuse unsafe work is something that we need to get across to our young people through the education, through school training, that's what safety culture is about, is making different decisions.
So, and I appreciate that, and the places that I've worked, I've been lucky enough to take some of these courses, and they are very useful and they're helpful. You do learn a lot, and you. My problem with that is, and something that I think we see a little bit of is, especially when we go back to these fly-by-night companies, if you refuse, then you're out of a job. So. One of the things that I wanted to ask you about is repeat offenders. So there are employers that are out there that are obviously repeat offenders. What are we doing to deter this?
Mr. McLean.
Thank you. That's a great question. In fact, there's a couple of points I would say about this. Number one, enforcement lies with labor and advanced education. Yep. So the big part of what they're doing is they've recently added 17 new resources further to the workplace safety strategy. And that means that rather than just have inspections that take place when someone drives by and they're constantly running around looking for the complaints, they're going to have the ability to be proactively
So spot
blitzing,
checks.
spot checks, and that means that they're going to show up in industries beyond just, fall from height, which a lot of us see, which generates a lot of complaints. They drive around. So this is going to allow them to be proactive. So I think, number one, the proactivity will be important. The new resources are important. And I think the government's new regulations around fall restraint are important. All of those things. So I think they're taking a lot of steps towards making sure that we have the conditions for success. The Safety Association also, Bruce Collins, who's here today, would say it's a key priority for their sector as well, and in their Safety Association and in their training.
Has there been any thought of tying it to, and you may already be doing this, so that's why I'm asking the question, but tying it to the Workers' Compensation Board premiums? So repeat offenders would have to pay a higher premium?
We don't have any mechanism today that talks about infractions. In other words, you have an infraction with the Department of Labor. Today, the way it's actually done is that they pay penalties and fines. And those penalties and fines previously went to the accident fund, but now there's a recent change with the government that has basically said that's going to go towards prevention and education and health and safety awareness and education. So that's again another, I think, a positive way of that money that was being funneled. We don't currently have anything in our experience rating model that looks at infractions. It's based on costs. So if your costs are high, you pay higher premiums. If your costs come low, you pay lower premiums, and that happens both at the industry and at the company level.
So, and my final question is, because I know everybody wants to get out of here. So what exactly are you doing for repeat offenders? So, I mean, how do we prevent repeat offenders? I know that there's a process, but what are we doing to stop these repeat offenders?
Well, I think number one, I mentioned that it is labor. I think labor, the new prosecutor that's dedicated for occupational health and safety, to me is another positive sign. But if you have somebody who's doing something over and over again, the fines need to be punitive. To me, it's fundamentally unacceptable for that, and perhaps we need a prosecution in this province to send a message that this type of behavior is unacceptable if it continues to happen over and over again.
Thank you very much.
Okay, thank you. Just want to give Mr. McLean a few minutes to make some closing remarks to the committee.
Well, first of all, I'd just like to say that we really appreciate being here. To my colleagues on the safety associations upstairs, I know that the content didn't lend itself that way, but we have strong partners in delivering the workplace safety strategy. We have a strong partnership with Labor and Advanced Education. We've got everyone is stepping up. And to me, if we want to see a different future in Nova Scotia, the best injury is the one that doesn't take place. And so we need to continue to have a resolve to focus on that, but that does not diminish the importance of us providing excellent service and doing our best to make sure that injured workers get the benefits that they're entitled to and the support that they need to get back to the workplace and be successful with their families, to the life that they deserve. Again, the progress is measurable, it's real, but there's still a lot of work that needs to be done. And there's a role for government as well in all of that. As an employer and also as the regulator, we would hope to continue to have the positive movement and success that we're seeing. And so I guess I would just leave it at that. We're very proud of our organization, and we're trying to make a difference. And so thank you for today.
Thank you very much, and thank you to all the witnesses for coming in here for the Public Accounts Committee. Our next committee meeting will be September 24th on the Blue Nose 2 restoration project with Mr. Dave Darrow appearing as a witness. And following that meeting, we'll have an in-camera briefing with CNS regarding advertising, procurement, and performance. And we now stand adjourned. Thank you.